Hi, I'm Casey Glassburner. I'm going to give you some more information about the labs for the SURT1701 Clinical Orientation course. So the first lab is a lot of review from the 1601 course, the asepsis course that the students took the very first quarter of the surgical technology program. So we spend a lot of time reviewing a lot of the skills and the information that they may have learned from that first quarter. So in the progression notebook, we'll spend time going through the contents of that, and then there'll be various activities. So I always sit the students down and get them to the 1701 section in the progression notebook, which is usually a green divider following that 1601 section. So you'll get to that, and then there will be a table of contents, which will explain to them everything that's included in the progression notebook. Okay. So then we just go through it. It has an example outline or lab schedule that's going to be generic, as well as the objectives that are to be achieved. It then talks about the participation grade, so you'll need to keep track to make sure that your students are on time and they're actually doing what they're supposed to be doing in labs. So 5% of their grade for clinical orientation will come from whether they're in lab and they're appropriately attired, and there's going to be a description right there where it talks about loss of lab participation points may result from some of the following things. So you'll need to keep track of your students' attendance, and also if they are showing up and they're not prepared, or they're showing up and they're not properly attired. After that, it'll talk about the weekly goals for clinical orientation. So just like in asepsis, we require students to set a weekly goal for themselves to identify a skill that they may need to spend more time on, that they need that extra practice to be able to master. So they need to set a goal for themselves based off the skills that are practiced for that week, as well as a way to achieve that goal. And then the next week, you as their instructor will need to take a look at that goal. And completing those goals is part of their lab participation points. So there's 10 labs and 10 points for each lab. So one of those points that is associated with whether or not they're doing their goals and turning those in for you to review. You can take a look at those and then make comments to the students, possibly suggest some ways to them that they may be able to achieve those goals that they have set for themselves. All right, then you're going to see a breakdown of each of the labs, so the agenda for each of the weeks. Okay, so you can page through that and you'll see the agenda for week 1, and we'll go more specifically into that here in a little bit. You'll see the information that's needed for week 1 as well. And then you'll go into week 2 and so forth. Okay, so it'll just have the breakdown of each of those labs all the way up through week 10 so that the students know what the agenda is going to be for each of those labs. Okay. Then you'll see the information for our distance labs. So these are for the students that will be attending labs in Lincoln, if they are going to be close enough to the Lincoln campus. So that information should not be applicable to you. It's basically the exact same information that we just talked about, except that we perform the labs in more of a condensed form, where the students are doing basically 2 labs in 1 week so that they have to drive less often to the Lincoln campus. So that's that whole section. And then after that, you'll get into the checkoffs that are utilized for clinical orientation. Now, these are important pieces of paper that you need to keep track of, and on the various different weeks, there will be checkoffs throughout the quarter. At the end of the quarter, you'll need to submit these checkoffs to us here in Lincoln, as we have to keep them in the student's permanent file for accreditation. So you can just keep them in the progression notebook as they're performed, and then at the very end of the quarter, then you'll submit those to us in Lincoln. So that's those checkoffs. So there are various different checkoffs, including the book walter, draping and attaching cords at the field. We have manipulation of an endoscope and the abdominal prepping checkoff as well that will need to be performed. All right, next you're going to have some example back table setups. So there's a whole packet of setups for the 3 hospitals that we mainly use in Lincoln. If you would like to provide your students with some drawings of some setups for the facility that you're in, that would be very beneficial to them. But they could utilize this just kind of as a reference as we talk about the various different types of table setups in the clinical orientation course. All right, after that, you'll see an image of a universal back table setup, which is the basic back table that we're going to be setting up, as well as the Mayo stand after that for the laparotomy competency assessment. You see some images of hand tables as well as vaginal tables as well. Again, just reference materials for the students as they review those various different types of setups. And then we get into the information for the competency assessment for the clinical orientation course. So you're going to see two different setups, a laparotomy setup and a laparoscopic setup. The students will learn both setups in the lab practice for this course, and then for their final competency assessment, they will need to perform one of them. And we always tell the students it's going to be random, so they need to be prepared to perform both, but they will only have to perform one for actual grading for their final competency assessment. Okay, so the first information that you're going to see is the information for the laparotomy or the open table setup. So in here we have the same information written three different ways. So we have it in a table format, we have the actual grade sheet itself, which has the points that are associated with each of the skills listed, and then we have the information written out in a paragraph form word for word, followed by diagrams or images of the back tables and the Mayo stands for pulling up on the right side and the left side of the patient, as those will be mirror images of each other. After that, then you get into the laparoscopic information. So the laparoscopic table for the competency assessment, you will see it written exactly the same. So it's the same information, just written three different ways because it makes sense to different types of students in different ways. So first you're going to see the table format, then again you see the grade sheet, then you see it written out word for word, and then it goes into the images and the diagrams. So we have a drawing of the back table, a drawing of the Mayo, and then pictures of the basin, the back tables, and the Mayo stands for pulling up on the right and the left side of the patient. We begin the practice for the competency assessment in the second lab after we finish the review, which will begin during the first lab. Okay, so if you want to go back to that first section for lab number 1, we'll kind of review what happens in lab 1. So it says discuss what to expect for the quarter. So we talk about the lab. You're going to go through them, what's in the progression notebook, discuss the handouts and everything that's in that section. We kind of talk about last quarter, just ask them if they have any questions. Make sure that their aseptic knowledge is, their foundational knowledge from last quarter is there. And if they have any questions about what they might need to review from the quarter before, we just kind of make sure that that knowledge is present so that we can build on top of it in 1701. Okay? We talk about goals and just asepsis and surgical conscience and those kinds of things. Then we go into practicing how to assemble an instrument set. So we do this for two reasons. I know when we sent out to you, we said we needed an instrument set for setting up, but in the lab, I have the students actually assemble that set so that they can review their instrument knowledge from last quarter and also practice how to work in the sterile processing department. Depending on where these students end up getting employed, sometimes surgical technologists are responsible for assembling that set. So they need to understand how to look at an instrument set contents list and how to gather all of those items and then assemble them into a set and then prepare that set for sterilization. So I really spend a lot of time talking to them about how a hospital will decide what goes in a set, how sets vary from one hospital to another, even though they might be called the same thing, and also how it's very important once they get employed in a facility to really take a look at what's in the sets and know when their surgeon asks for something if they need to call for a complete set or if they can call for the individual item, just depending on what's present for and available for the surgeons and the team to utilize in the specific facility that they're working in. So we just talk about the sets and then we practice how to assemble a set. So they'll utilize that basic laparotomy set contents sheet. Here I have all kinds of instruments and they have to actually pull them. For you, if you only have that one set available to you, you may just have everything laid on a table and have them identify what the items are and then kind of assemble it into a set and organize that into an instrument tray. After they go through and identify the types and the numbers and the sizes and all those kinds of things, I make sure that they ask me lots of questions so that we know that their instrument knowledge is there from the quarter from before. And then we talk about how to get that set ready for sterilization. So placing the two indicators in opposite corners, making sure that everything is open, everything is disassembled that's in the set, getting the Genesis pan ready, putting filters in the top and the bottom, putting the tamper evident locking arrows on the outside that are going to have a chemical indicator. And again, just reviewing the set and what can make a set unsterile. You know, if the filter is shifted off to the side, or if the plate's not locked in place, or if it's missing the arrows on the outside, and just reviewing all of that information about the set. All right, then after that, we go into talking about the surgeon's preference card, and we practice how to pull a case cart. Now, in your facility, you can utilize the actual real live case carts that you have in the real preference cards. In the lab, I have a mock preference card, and we have kind of a mock central sterile supply area, which that information is going to be included back here. So that's the one that we use, but you could definitely utilize the preference cards in your facility. The goal of this is just making sure that the student understands what a preference card is, what's included on a preference card, and how to read that preference card and be able to gather the necessary equipment and supplies that are needed for the case. Also, we talk about how to pull a case cart because in some facilities, depending on where the student might end up working, it may be their responsibility as the surgical technologist to actually pull the case cart. But even if it's not their responsibility, they then are responsible for making sure that they go through the case cart and ensure that everything is present that may or possibly be needed for that case, and just discussing the importance of being prepared ahead of time and, you know, just being over prepared, where it's better to actually have the items there, and then if they don't get open, they don't get open, but at least you're not having to run for them and then delaying the case. Okay, so we talk about how to pull that case cart. Then we also talk about how to find the case cart and then bring the case cart into the room and set the room around. Identify what's open and hold, go through with them how to look at that preference card, identify if you're going to open a supply or hold a supply, and then also how to place them around the room. That the pack goes on the back table, the basin and the ring stand, the instruments set on a flat surface like a prep stand or a ring stand, and then all the other open supplies on the bed because the patient won't be in the room, or a Mayo stand or some other surface. All the hold supplies are organized on the top of the case cart or on some surface where they can easily be opened by the circulating nurse to the team if they're needed during the procedure. So just going through that importance of that whole preoperative case prep and how it really makes a difference in how efficient the case goes. After that, I have the students actually take and put the supplies away so that they're practicing that, because that's another part of the surgical technologist's job, being that those sterile supplies that don't get used do go back into distribution and circulation as long as the integrity of the package is not compromised. All right, after that, we review the preliminary preparation of supplies and equipment that the students learned at the very end of 1601. Oftentimes there is a break between those two courses, and sometimes the students don't retain a lot of those skills very well, so we really make sure that we review those skills again. So you can see the whole listing of skills there that you'll need to make sure that you review with the student. Since the student has been taught this information before, I really try to have them show me what they know and then provide additional information or suggestions about their technique, or maybe some information that they have forgotten. So you could utilize their instrument kits for some of this, or you could utilize the instruments that you may have in the facility as well. Okay, just making sure that you go over each of those supplies, the draping of the Mayo stand, and just offering additional techniques about efficiency, safety, and the proper technique for doing all of those things. All right, and then finally, we review the brushless scrubs. Because for the competency assessment for clinical orientation, the 1701 course, they will be performing a brushless scrub, not a full brush scrub like they learned in 1601 and did perform for the competency assessment for asepsis. So in Lincoln, we have 3 different types of brushless scrubs available to us: Triseptin, Avogard, and All Care Foam. I have the students learn all 3 of them because once they get to the clinical sites, each of the clinical sites has a different brushless scrub. So what I would like you to do with your students is just review and go over the specific brushless scrubs that are available to them in your facility, and then that will be the brushless scrub that they will utilize for the competency assessment that they perform at the end of the clinical orientation lab. And that will be it for that very first lab. That should take you, a good chunk of time to get through all of that, depending on how many questions they ask and those kinds of things.